So now let's fast forward. We have the FDA has cleared certain indications for that.
Before even the FDA, what had happened was they started using it as an alternative method to do heart surgery and replace valves. Because if you supersaturate the body, you can extend the length of time that you can go without oxygen out to 13 to 15 minutes. So therefore, it gave them more time to do valve replacement. Now that was short-lived because they came up with a bypass machine that actually made that short-lived.
So the operating rooms themselves were chambers, big chambers. I've seen the steel plate operating room walls where the operating room was put under pressure.
Exactly. Now the thing is, but this hyperbarics could have taken off at any point in time. That next opportunity to take off was in about 1963. In 1963, President Kennedy actually had a premature son that had a condition that was having a hypoxic event following birth. And so at the time, Harvard had a hyperbaric chamber, and he was placed in there. Initially, he did very well. However, we didn't know the extent of the use of hyperbarics. In other words, we didn't know much, or we didn't know a lot about the toxic effects. And we didn't know the therapeutic limits of the use of oxygen. Now, he was treated at a much greater pressure than we would treat people today. And he was treated for an extended time, out to 7 hours. So when different physicians got involved in it, they said, hyperbarics, that's that thing that killed the child. And that's pretty much a bum rap there.
It's like drowning from drinking too much water.
Yeah.
I mean,
but, so that has been difficult to recover from. Fortunately, we have Europe and the USSR at the time that were able to do hyperbarics and develop whole systems where, in fact, in former USSR, there were hospitals that were, their principal treatment was hyperbarics. And when we initially went into hyperbarics, or when I initially went into hyperbarics, if we questioned how to do something, we had a machine translated version of a Russian manual that actually would tell us, this is how they did it. This is how you treat a neonate, which at the time we didn't treat neonates. So I mean, so it was a go-to thing that we would use just as a reference. You had different physicians like Jefferson Davis that actually fostered hyperbarics and actually came out of the military. So a lot of the physicians that were in hyperbarics came out of the military. Now, being around 31 years, I've been around some great physicians. I mean, just true pioneers in hyperbarics and
doing a tremendous amount of healing, and so we see this great opportunity to really advance medicine, and along comes the FDA, right? And so you have
they actually say, let's justify what you're doing. Now, in 1967, that's kind of when the Undersea Medical Society came around. What they did was they go, okay, this is the Wild West. We need to rein this in, and we need to identify the rationale why we're doing this so that we can structure this into a offering in medicine, a therapeutic offering into medicine. And you had doctors like Dr. Kinwall, Dr. Hart. These are pioneers at the time that were instrumental in the formation of the new medical society. That was both a curse and it had a lot of positive effects too. But the thing was, they put hyperbarics and undersea medicine together, and that's been a problem within that, and it certainly prevents the thought of clinical hyperbarics progressing independently of diving medicine. So
I see it as it's the Achilles heel of hyperbaric oxygen.
Right, that's one of them.
Yeah, one of them. And so when did the FDA come on the scene?
About the 70s, they were starting to look at application of hyperbarics.
When did they get to the point where they
well,
were clearing them and saying?
See, the thing is, the FDA actually goes on the recommendation of the industry. So you had the Undersea and Hyperbaric Medical Society then recommending, and they produced what they called a committee report that looked at the indications. Now, the indications were a lot more than what we have today. And since that, it's been refined. And that looked at rationale. It looked at number of treatments. It also looked at critical review points where you would actually do reevaluation. And it talked about the cost-benefit ratio of the different indications.
Therapies.
What the thing is the common thing is that throughout anything, hyperbarics is effective for hypoxia and inflammation. And anything that has that associated with it can be positively affected. Now, is hyperbarics a cure? Often it's not. It's definitive in the use of its use for decompression sickness. It's definitive in its use for air emboli. Depending on which issue of the committee report you read or who's presenting, it's definitive in the use of carbon monoxide poisoning. Although that indication has been debated as a definitive use, but
So it's not a cure, because a cure would mean that you're going to return to baseline, right?
Exactly.
At least what I understand is that very often you get real close, okay, but so there's some residual permanent effect. And of course, you know Bill Duncan, and he had Patriot clinics out there in Oklahoma. And he was at my house. We were at dinner, and we had brought in a group to try and understand, if this was something that for me, if I was going to put time into, I really want to understand it. So we had a 2-star general was in a meeting and everything. So this is a dinner at night after this big meeting with doctors and a couple chiropractors, and we were all sitting around the table debating this for a Saturday for many hours. And I said to Bill, Bill, the only thing that I think hyperbaric doesn't do is bring back the dead. And Bill said, that's not exactly true. So he brings up this case of this young man. He's underwater in the Mississippi River outside St. Louis, I guess, and he's down for 29 minutes. They pull him up, stick him in a chamber, and then he's on ABC News. 12 years later, he's a really brilliant person, and so that was his point. And then we talked further, and he said, look, if it brings back the half dead.
Right.
But it doesn't bring back the dead. It brings back the half dead. And so obviously there was some condition that allowed this person to at least not be dead.
The thing is that we need to focus on, though, is hyperbarics as a tool. And it's just like the artist, okay? You can give an artist a paintbrush, and what's the difference between an artist and a house painter, okay? In the right hands, hyperbarics can do wonderful things. Mm-hmm. In the wrong hands, most often it won't do bad things, but it will not have the desired results. So timing becomes important. Mm-hmm. So that's why I've been trying to emphasize it's the art that's missing in medicine today. You can hide behind science. You can say, hey, listen, this is science. We just recently heard the chief physician, NIH, Dr. Fauci, said, if you criticize me, you criticize science. Okay? Well, that's kind of wrong there, too. So the science issue is the issue, but it's the art of using the science. The science is the paint. The artist actually renders the paint into either a masterpiece or a house painting.
Yeah, there certainly clearly is an art. One of the things that that I've seen at the clinic, and we talked about this in that earlier segment with Elena Schertz, was in looking at cancer. She throws everything at it: the vitamin C, the electromagnetic flux, the beamer, hyperbaric oxygen, and diet. Reduce sugar and all that, and gets a great result. And to me, that's the art. It's like you have to make sure they can tolerate the vitamin C. It's a simple blood test, right? And I don't understand all the nuances of what they're looking at in the blood, but I do understand the test is done, and you either get cleared or you don't for high dose vitamin C because I think your liver can't handle it, or your body's not going to digest it properly, and can be work against you. It's what you mentioned earlier, the dose. So it's 21% oxygen, normal air, doing 100% oxygen. How long? Back to the Kennedy kit, too long. It's things like that. That's the art, is it not?
That is the art. And the thing is the timing, okay? The earlier we can get and close to the injury, the better the outcome with the least amount of treatments. I'd like to say we can cure everything with one treatment, but that's not realistic, okay? So the thing is having somebody that recognizes the role of hyperbarics and how to apply it. And that's the art.
So if you have someone that understands how to apply it, to me, the only recommendation that I would advise you against is not doing it.
Yeah, and if you look at that, that's true. The thing is, hyperbarics has very few complications, and most of them are reversible. Okay, it has a safety record. The safety record is enviable. If you look at it, there's nothing else in medicine has a safety record of hyperbarics. Yeah. And yet people will always say, well, the go-to thing by many physicians is, well, there are no recognized studies that show that it's effective in that. You know what that says? That says that doctor is not taking the time to look at this, doesn't know what else to tell the patient, and therefore he is not giving it a true look at what it can do.
Yeah. Well, if you look at clinicaltrial.org or .gov in the government and see, what research is being done, I've done this. Just look up keyword inflammation, because we know that that's clearly a factor here. And there's like 7,000 studies that include something that's happening as a result of inflammation, or hypoxia probably would be the underlying cause there, as you've said many times here. And then you look up hyperbaric, or you'll just look up hyperbaric, and you'll find 400 current clinical trials at some, beginning, mid-stage, or they're looking for patients, or wherever they are. So clearly there's interest in it. And this, for me, a lot of it, what I see is just kick the can down the road when we already know that it's helpful. So why aren't we using it in just a therapeutic way to help people, no matter what this hypoxia is causing, this inflammatory condition? We should just be doing it. It's so frustrating for so many that are in this field, is it not?
It is very frustrating. And the thing is that we're just understanding the science behind and the microbiology behind the application of oxygen. In 2019, okay, the Nobel Prize in Medicine was awarded to 3 individuals for defining the role of oxygen.
Warburg, is that?
No, that Warburg was back in the 1930s. Okay,
he was cancer, right?
He looked at hyperbarics, or he looked at oxygen and the role of cancer and the metabolism of the cancer.
To Tom's point, it's very clear, and it's no surprise that a lack of oxygen causes this hypoxic environment in our bodies, and it can be caused by nearly every indication that is out there, is going to worsen or cause disease state. So it is a pathway. And it's also clear that hyperbaric oxygen, driving oxygen into our blood plasma, provides the oxygen that's been depleted to those organs, that area, that this disease state could be worsened or caused. And it just seems to me that we can spend a lot of time, look for an example like exercise. It's slowly coming out. Diet. It's slowly coming out. How important diet and exercise are to our health. And do we need to do a clinical trial and test it against every single indication that's out there to conclude that you have diabetes? It's really good for you to change your diet and to exercise. Or you have heart disease. It's really important for you to do certain exercises and change your diet. Or any indication that's out there. Do we need to wait, or should we just move on this very quickly? And then we can collect all the data and we can say, yeah, we were right all along, because the pathway is clear, the opportunity is clear for those of you that want to delve into and try hyperbaric oxygen, I think you're going to find that whether you're dealing with something currently or you may be having, something going on that you're not even aware of, that it's not going to hurt you, that it's a good option. So really enjoyed Tom's visit and that conversation with Tom. Look forward to having Tom back and possibly in the future get into some other topics, because Tom is, as I said earlier, the historian for hyperbaric oxygen. He's collected so much information over the years. So we look forward to having you back, and hopefully you got something out of this conversation that is valuable to you. Thank you.